Clinical physiology is not the only branch of physiology that is, satisfied.
Please! I'm desperate! I don't know what to do! Please subscribe!
As a physiology student, I've had the opportunity to complete 3 clinical postings. The first one was in a federal medical facility, the second was in a state medical facility, and the third one was in a school's teaching hospital. So, what do you need to get clinical placements as a physiology student? Basically, you need, I would say you need 3 things. You need a recommendation letter either from your HOD, your head of department, your dean of a faculty, or the provost of a college of medicine. It depends where you get yours from. So you also need a personal application letter, and also need to be determined and need to have the zeal to learn, because you're bridging the gap between theory and clinical practice. So you should be ready to learn and learn new techniques and also adapt to it. So the recommendation letter from your HOD, your dean, or your provost of your college of medicine is just to attest that you're a student of that department. So you need to write a personal application letter. Now, so your personal application letter will contain a bit of your profile. Then it should also you should also include your the department you want to do your clinical postings in, because you have to be specific. Some hospital administrative units don't really know where physiologists need to do their posting, or where physiologists can function in the hospital. So most of them they will just post it to any department. So you have to be specific. Okay, I wish to do my rotations in internal medicine, maybe radiology, then surgical ward. So it depends on the hospital. So you have to be very specific so that you be posted to your desired department. Like the first, second, and third, I was supposed to department like accident and emergency, operating theater, internal medicine, that's cardiology, neurology, nephrology, pulmonary medicine, and endocrinology. Then I was also posted to radiology, so I was exposed to ultrasonography, film reading, and x-ray. Then I had the opportunity to also go to pathology, then lab medicine like hematology and chemical pathology. So most times it depends on the hospital. Most hospitals don't have this variety of units, so you have to be sure that particular hospital have this unit before you apply, so that you won't go there to waste your time. Before you even get your I forgot to say this, before you get your application letter, your recommendation letter, and all that, you need to know if the medical facility you are applying to accepts students. Not only IT, if they accept students generally for clinical experience, then you are at a higher chances of getting accepted, because most times you might just apply to a hospital and they don't accept your distant application. When they accept your application, you feel like, oh, maybe because I'm a physiology student, or maybe because they don't want physiologists in the hospital. No, most times they don't really. There are some hospitals that don't need students, for clinical experience. They work they use or they accept majorly professionals who are ready to work, and so you need to know if the hospital or the facility accept students for clinical. So before I talk about the role of physiologists in internal medicine, there are still other departments where physiologists can, work in, like their specific roles. So in internal medicine, we have cardiology, nephrology, endocrinology, and all that. That's catheterization and geography, and there is some dialysis, renal function test, ultrasonography, and more. Then in radiology, you could be an ultrasonographer, or ultrasonography technician, assisting radiologists with scans, and more. Then in gastroenterology, you could do procedures like endoscopy, and other diagnostic tests relating to the GIT system. Then in respiratory aspects, you could do spirometry, lung function test, bronchoscopy, and other invasive procedures. Then hematology, you could do, although your chances of being in laboratory medicine are very slim because of the medical lab sciences. So in some facilities they may accept you because of your knowledge of blood physiology and renal physiology for ChemPact. We're talking on physiologists in internal medicine. I think internal medicine is the most popular department where physiologists are posted to, or physiologists work, because of the ECG. So when they hear physiologists, they believe that it's just ECG. So an ECG is a unit in internal medicine. So that's why internal medicine is quite popular when you hear, okay, where can a physiologist work in the hospital? So I will talk to you about my experience in internal medicine. I've been posted to internal medicine twice during my postings. So I've had some time in internal medicine. I have some experiences in internal medicine, where I was exposed to electrocardiography, echocardiography, catheterization, that's cardiac catheterization. I also was exposed to the spirometry, even the stress ECG, stress echo. I was also exposed to I saw how dialysis functions. So what are the roles of physiologists in internal medicine? This is based on experience. Like, I've been in internal medicine for some time. So based on experience, there are some roles that are, for physiologists. So in cardiology, you perform ECG procedures. Like, if you're good in interpreting results, you can analyze them. But some federal medical facilities only want the cardiologist to do that. Unless maybe you're good and maybe you may be supervised by the consultant cardiologist. But in private clinics, and you're very good in interpreting and analyzing the ECG test results, you can do that as well. Then you could also do cardiac catheterization and also angiography procedures. You can also do echo scans. Then for gastroenterology, you can assist in colonoscopy and endoscopy procedures. In neurology, you could do procedures like EEG, EMG, NCS, EVP, and other neurological procedures that could be helpful in diagnosing some neurological conditions. So like in respiratory medicine, you could run spirometry tests. Then you could also be a dialysis technician. You could be trained, or if it's a skill you already have, you could be employed in the dialysis unit to be a dialysis technician. Then there are also other procedures, even other invasive procedures like placing cardiac pacemakers, and even doing abdominal pelvic ultrasound, especially for radiology. Like, if you have a skill, if you're an ultrasonographer and you're very skilled and you know it very well, you could be employed to be the ultrasonographer or the ultrasonography technician, and you'll be supervised by the consultant radiologist, maybe too, when you're good enough to interpret, but you still be supervised by the consultant radiologist. There are still other departments like the operating theater. You can assist the surgical teams monitoring vital signs and also supporting the anesthesiologist. You can also work in intensive care units, and there are more and other even in emergency wards, even in for reproductive physiology. You can even work in the OB-GYN department. There are numerous departments, there are numerous opportunities available for physiologists that are ready to specialize in the clinical aspect of physiology. Clinical physiology is not the only branch of physiology that is satisfying. I would say because it's just that it's the most sought out for in Nigeria because of I would say 90% of physiology students wanted other professional healthcare courses like medicine, dentistry, nursing, and all that. So finding themselves in physiology, still want to be in that clinical setting, you know. So that is why a lot of persons want to go into clinical physiology. Not really because there is really anything in it though, but they just want to go into clinical physiology because they wanted to be in clinical courses like medicine, dentistry, and all that. But practicing clinical physiology in Nigeria, I won't say it's rare. The practice is, I won't say it's very rare, but physiology is evolving, but a lot of professional bodies are rising up to regulate the practice of physiology in Nigeria. But you know how Nigeria things happen. So, but nevertheless, you still have work to do as a physiology student, as an individual. So you have to, go out there and seek for placements yourself. You have to go out there and help yourself. Waiting for some associations, some professional bodies to. I'm not saying that these professional bodies can't help you, but the probability of them helping you to your satisfaction, it's very low. But if you go out there to make good use of the opportunities you have, and you'll be very good at it, and you would do well in the area of physiology that you want to specialize in. If your school offers IT placements, that means you are at a better chance of exploring clinical applications of physiology. But if your school doesn't offer IT, so you should consider going for clinical postings, because it will help you if you really want to practice clinical physiology. It will really help you. You should go out there and seek for experience to help you, and a lot of other options for physiology students. So this was actually what I was exposed to in internal medicine. I had the opportunity to explore this department, even perform these procedures myself, assisted the doctors or the technicians in charge. So if you found this video helpful, kindly give this video a thumbs up and share to every physiology student out there to encourage them, those that want to pursue a career in clinical physiology, to help them so that they would pursue the career in clinical physiology and become the potential clinical physiologist that they want to be. So guys, see you in the next video. Bye.